Good evening, good afternoon, ladies and gentlemen. I hope you're all well. It's a pleasure to be back at the SETU tent here at the Ploughing Championships on the final day. Yeah. The weather has stayed fine, Barbara, and yesterday we had a windy experience, but the tent stayed intact as well. That's very, very important. So today we're going to have a discussion on, I suppose, well-being and I suppose mental health in the farming community, and I'm delighted to be joined by a number of experts in the field. And I suppose the mental and physical well-being in the farming community is a massive consideration for everybody that's from a farming background or works in the area, or industry experts like we have here. So John McNamara is the head of Teagasc. He's our first guest. Tracey James then is sitting beside John. Tracey is the health check manager with the Irish Foundation. Beside Tracey is Stephen Mbwika, engage on Feirm Ground practitioner as well, and it's a pleasure to have you here with us today as well. And alongside Stephen then is Barbara Moore, who's a researcher here at SETU. But Barbara is a social science scholar and a researcher and a specialist in this area. So I suppose the first thing we'll say is none of us here are experts on farmers' mental health, but we're experts and hoping to be an expert on, I suppose, the research in the area, Barbara. And walking down through the complex here today in the campus, all sorts of perspectives on farming life and all sorts of backgrounds. But fundamentally, when it comes to farmers' mental health, I was chatting to a guy yesterday, and he just said even going for a walk can help lift the burden. Can you just talk to me about the issues that farmers face on the ground and maybe a primary way of how they cope with it?
Okay, I think what's really important to say is let's have a conversation before we have to have a conversation. And that's what we all want to do, kind of just about health is physical, emotional and psychological health. It's that wholeness, that whole being, not just one thing. And there's no one farmer. This is the farmer. Farmers are individuals, and we need kind of an individual response, and we need to understand the context. So sometimes you can kind of hear, farmers are having problems, but we don't want to problematize farmers. There's lots of stresses and strains, and farmers are facing these stresses and strains in structural and cultural areas as well as at an individual level. So it's really important to kind of understand what's going on out there, rather than kind of just, this is what the problem farmers are having, or this is, a problem for farmers, and not to problematize it, but to say, how can we respond rather than react to this? And I think that's really important. And I'm sure everyone would agree. And there has been a real commitment, and John is like an expert on kind of the response to farmer health all across the realms. So it'll be really interesting to hear what you think, John.
Okay, no, I'm at this for over 30 years, but the bottom line in the early days was that farmers think they're healthy, but they're not as healthy as they think they are. So we got involved in health promotion, really. Yeah. Now, we adopt the total health, worker health model, and that really means health, mental health, and safety. Health promotion and safety all integrating with each other, because they all interact with each other. Now, moving on to research, there was great research done by Eamon O'Shea. You'd know him from the football field. That's what got me going. It showed that farmers had very high cardiovascular health and had high cancers. I looked at his paper there a few days ago, so we got involved in that. Also, there was a famous study, a Kilkenny Health Project, that we were involved with, and it did health checks back in the 80s, and that got us going there. So really, we're trying to convince farmers that to look after your health, for its own sake, but also for farming's sake. You can't farm unless you're in good health and that. No, I'm glad to say over the years we've got a lot of traction with and it's based on having research and having data that farmers respect. We're seeking always to gain farmers to voluntarily adopt, health promotion approaches, in their own interests.
Okay, brilliant. Tracey and Stephen, I'm interested to hear your perspectives first of all. Stephen, just from yourself, on Feirm Ground, can you maybe tell us a bit about your programme, but maybe also about research findings over the last 7 or 8 years here in this sector?
Hello. Yeah. So thanks so much for that. I think the first thing maybe we need to acknowledge is that farming is more than a job. You know, it's a way of life for most farmers. And with that comes a lot of, sense of pride in the farming itself. And we also need to acknowledge the fact that, there are challenges, pressures that are associated with the farming. But then there is a culture in farming that, says, get on with it, keep going. And that kind of culture is the one that keeps, farmers or makes farmers find it so hard to open up in case things are not going on well. And the other aspect that, as my colleague here has mentioned, is the aspect of farmers, wellness, having an impact in the productivity of the farm. Because most of the time, when farmers have challenges, they prioritize their farm, and then they come second. And in those kinds of situations, then some health issues, end up going unchecked. Yes. And that's why it's important for us to keep talking about these conversations on the health and well-being of farmers.
And Tracey, you come in there then, with your work with the Irish Heart Foundation. Have you seen any change you've been very proactive with this, but have you seen any change in response on the ground from farmers with your programme?
So the Irish, the Farmers of Hearts program has been going for over 10 years, and a lot of our nurses have been working, from day one. So we were able to get that, I suppose, unofficial qualitative research to see the changes from the beginning to now. And there's definitely been improvements in how farmers see their health. And there's been more empowerment. So we're seeing in our questions that we ask, and the same questions have been pretty much asked, the whole time, that more farmers are seeing their GP and are going the next step after having our health check. Based on this, we're able to, tailor our program to the next challenges after that. So they are seeing their GP, but they might not be taking their medications or being compliant, or they are thinking that they're doing enough exercise, but it's not aerobic. So we're able to tailor and again, it's unofficial qualitative data because we're speaking to the farmer in a 10 and 15 minute one-to-one interaction. And
that's fantastic.
Yeah, and we're able to get that, that richness of information that's more meaningful, I guess, than paper data.
Yeah, you had a lovely little anecdote there about asking someone when he saw his GP, and do you want to tell?
Oh yeah, so I was doing checks yesterday in the HSA tent, and I spoke to a farmer and I asked him, when was the last time that you saw your GP? And he couldn't tell me, and couldn't remember at all when was the last time he had a blood pressure, couldn't tell me, but he could tell me when was the last time he saw the vet. So, there's that, there's that priority that's, that we need to focus on and bring it back to the person, basically.
Yeah. And I think that highlights a very important aspect that ties into the program that we do, the on-farm ground. So the on-farm ground acknowledges the fact that, our farmers would not make, the first point of call would not be a health professional, but they are always opening up to the people they interact with within their networks. And these people would be vets, they would be advisors, generally the people they regularly interact with. So, there is a research that was done, and John McNamara was part of that committee that is called On-Farm Ground, that brought about the On-Farm Ground program. One of the things we are trying to do at the On-Farm Ground is acknowledging that fact that farmers are opening up already to the people they interact with. And she's saying they're opening up to vets, they're opening up into advisors. Mm-hmm. But then when they open up to these advisors, most of the time the advisors don't feel equipped enough to talk about those conversations. Yeah. So there is need then for them to be equipped with the tools and the confidence to be able to hold those conversations. So On-Farm Ground now equips them, yes, with those skills.
Maybe just to go back to answering the question about how farmers' health improved, there is a series of studies, and the most recent one was an ERSI study which gives data on cardiovascular health, and it shows considerable improvements towards a decade ago and a decade before that. So, no, I'm glad to say Teagasc, we've funded two research PhD studies with SETU. The Farmers of Hearts, Dr. Diana Van Doorn did it. And, I think it's a terrific study, it gives data. And, we need to get farmers in and we need to connect them to healthcare professionals, really. And that. Now, the other one on Feirm Ground, that is a training course for advisors and veterinarians and anyone that's engaging with farmers. And it's training people in signposting, to listen to farmers first of all and to encourage them to use health services, both physical health services and mental health services. And the data would show that the training, and it was very well designed by Dr. Noel Richardson led it, and the PhD study would show that the training is very effective, with people.
I think it's very important to say as well, that study didn't start at a greenfield site. That was built on work that had been done by the HSC and the Department of Health. And there's a real commitment, there's called it like a community of intention that committed to farmer well-being and the sustainability within farming. And that the programme on Feirm Ground was built on the Engage study that the HSC had run with the Department of Health on working and understanding specifically, not all farmers are men, but many farmers are men, and understanding there are specific challenges for men in kind of accessing health and patterns and cultural patterns, as Stephen was saying. And that's really important, isn't it, that we're working on an evidence base. So the On Feirm Ground was built from research, and that everything has a research base, and that's really important to Teagasc, to the departments and for us on the ground, as it's not just academics, and really kind of hearing also from farmers and their expertise and their experiences and utilising that in the programmes as well, and not kind of coming in, we're the experts, but rather you're the experts in farming, we're the experts in health, mental health, and that let's work together. And I think that is why it has been so successful. Because everybody's respecting the other person's perspective, and I think that's a really important part as well.
Yeah, sorry, John.
Thanks, John.
Yeah. I agree with everything that has been said, and that. No, just one important point. That farmers are that they're all out in the country and they make voluntary decisions.
Yes.
It's not like working in a factory.
Yeah.
Where kind of conditions can be imposed. So we're always coaxing farmers, if you like, to do health for their own good and their own farming good as well.
Yes.
I should say as well that the Department of Agriculture, along with the Department of Health, are supporting on Feirm Ground programme.
Could I ask all of you then, right? We're not here today to problematise or stigmatise farmers, not at all. But we're here to understand the challenge in industry and environment and external factors that they face on a daily basis. And we've spoken to farmers about the dread of a government stamp letter, Barbara, coming into the post and the post box and seeing what's out there. But through all of your work then, and you're all tied into the same overall goal with different fields, are we better understanding the needs of the modern day farmer? It's 2025, society is changing incredibly around us. Are we understanding better through research how to deal with the farmers' issues at hand? And I just start off with you, John, on that.
No, absolutely. And I think just to move back to stress, regulations and all that are a big cause of stress, and paperwork, and as you say, the HARP and that. No, but to be fair to the department, they're working very hard on that, to streamline their systems. And on Feirm Ground and advisors and all that, we're working on very hard to assist people. So to restate it again, anything we do is evidence-based, and most definitely we are moving forward.
Yes.
Tracey, you're in a situation whereby it's a privileged situation in a way. You're getting to meet these people one-on-one, and the research and data you're getting back might be unofficial, but I'd say it's the most accurate of the whole lot. Would you go along with that?
Look, I think it complements the official research, so it definitely does. It's all about testimonials and getting feedback and able to, structure your programs to that. So back to the question, do we understand the modern farmer? We definitely do by going and reaching out to them. So it's not uncommon for officers to have health promotional programs for their staff, and for a company to come to an office to do checks. So we go to a mart instead. It's the same concept. We're going to the person's place of work where they spend most of their time, and that's something that we have to continue doing because we recognise the challenges and the differences of that type of work and the hours. So yeah, just like any other workplace program, it's the same, going to a mart.
Stephen, as regards then the data that's coming back, and we're in a very instantaneous society. People want results now straight away. Does the farming sector understand the journey that research data takes into coming into a pilot project? And I think all of you guys here today have shown that there is real action coming at the end of the line. Is there an understanding of the process you must go through to get to that point?
But generally there is improvement in terms of that. And one of the things then about what the research is showing us is that for us to get through the farmer, then farmers are more likely to listen to you if the kind of information you are giving them is a bit informal, very unstructured, like that, a cup of tea kind of conversations. Then that way, then you will be able to get to get the, farmers listening to you. And the other aspect is then which are these people that farmers are already, talking to? Because one of the things that is coming out of research is that farmers, open up to people they already trust. Because in the culture of farming, there's that aspect of the stigma around, health issues. They are always afraid to be seen, opening up is seen as a weakness in them in that kind of culture. Yeah. So there is that. But they open up to people they trust and the people they connect with. And these are people who understand their world. And so there are people in the farming community. And that's why now this program then acknowledges that fact that is coming out of the research. Then how can we then empower the people that farmers are already talking to so that they are able to ask these questions? Then when have you seen a doctor? And we talk through, we train them on how they can deliver those messages in a very gentle, in a very informal kind of way. As you take care of the animal as a vet, then you bring in those health conversations in a very natural. And that kind of information is coming from the research that we are gathering. So it helps us in designing content that speaks to the needs of the farmers themselves. Yeah.
Yes.
Yeah. No, just to come back to research, the output of research is
quite high.
Yeah, no, but the output is very high.
Yeah.
But there were two strands. Now, we publish in top peer-reviewed journals, and they're available to the scientific community. Now, the other side is that, in Teagasc, we're very strong on this now, that we communicate our research findings, along with our partners, to the farming community. We never just go off and do research and just run off to the journal and away you go to the scientific journal. Yeah. No, we will interpret it for the farmer. We will publish it in our scientific magazines. We will put it up on our social media. It will be at our events. It's here today, down on our stand. So we're having a conversation with farmers, an ongoing conversation. And, we have direct evidence that it is working, that health and safety can be seen as a dry old subject. But farmers, in the recent survey that we did of our publications and that, rated health and safety and the messaging they're getting very useful and, very highly had very high regard for us.
Barbara, can I come to you on that one then?
Yes.
Because just before I came over to the tent, I was looking at the HSA, the Farmer Safety Demonstration.
Yes.
And it's incredible to see how a distressed mind can just wander and maybe do things that are not quite safe to do.
Yes.
Because you're distracted and you're not fully concentrated.
Absolutely.
Is this why your research matters so much? Is it just one of the reasons why it matters so much?
what matters so much is each farmer, each individual. That's what matters. Because if we don't have farmers, we don't have farming, and then then there's the whole other. And it's like each person is valuable. And sometimes you kind of, as you say, there's a farmer out in his field and he's doing his job and he's doing his thing, and it kind of feels isolating a little bit, or that no one's listening. And really, kind of the whole community, as John was saying, from the departments working together. That's the first time that's ever happened. Yeah. Working together in research at every level, the advisors, the people who are at the coalface, everybody is concerned, because every person, every farmer is important. Their lives, their livelihood, not just what they do, but who they are, is really important. And we have to meet them where they are. And that's why we do the research. And our research in Ireland is reflected kind of broader. It's not just an Irish thing. We respond to Irish contexts, but we're, the research that we're doing, looking at how to get men motivated to take care of themselves and understand that kind of being good to yourself is kind of being a good father, a good farmer, a good husband, a good, and all of that at an individual level. Basically, what everybody wants is for farmers to be able to reach out, and there'll be help there if and when they need it. And that's a really important message, I think. Would you agree?
Yeah. I think that's very important. And sometimes even in the discussions and what is coming out from the research is the aspect that there is need for us to be able to connect between the healthy farmer and the productivity of the farmers, we have said. Because sometimes, farmers will put more effort in their farm, even in checking in on their machines, servicing their machines. But when there are issues with their own selves, then they keep postponing. So that connection of a healthy farmer is also a safe farmer, it's very important for that kind of connection.
Absolutely, No, go on, John, you were saying, I'll come back.
Absolutely. I think what you're reflecting there is a couple of things, but the total health, worker health model, that health and safety go together. Yes. A distracted mind or a stressed mind, and you can have an accident in jig time. Could I just mention as well, with the breadth of research that's been done, we've a lot of research on farmers' lifestyle, right? We've a very good study done with SETU on what farmers eat. You might wonder why we did this, but it was to figure out why they're getting so much cardiovascular disease. And the finding was that their diets were very poor, and their weight was overweight. And another study done in University of Galway, studied the number of steps and the exercise that farmers get. And, they get lots of steps, 13,000 steps a day or thereabouts, but they don't get that moderate to high level of aerobic exercise that they need.
Yes.
Now we've done the research. We then tell farmers, now when you tell them the first day, you're not sure, you might get, you might get, but farmers and farmers leaders are very responsive and very positive to well done research and to the messages. So the scenario moves on and people accept the message and start to take action.
Yeah. And Tracey, from your point of view then, you're suddenly, with this data and research, you're telling a farmer who's worked maybe 6 a.m. to 7 p.m., who's covered 30,000 steps, that they possibly need to find a half an hour, 40 minutes to do cardio work somewhere in the gym. That's not an easy sell either, is it?
Yeah, look, it's letting them know that it obviously doesn't have to be the gym, but it's almost just simply saying, when we ask the question, are you, physically active, at least 5 days a week, and most of them say yes, but then it says, we sort of say it in a more simple term, is like, do you work up a sweat, can you feel your heart? And then they're like, actually no. Yeah. And I said, that's what you need to do. So it doesn't necessarily saying they have to go to the gym. If they are doing those steps, they can just do them a little bit faster. Yeah. It's not about having to do something completely different. Just say that they have to, what our nurses say very simply is, do a brisk walk. And you're still achieving those steps, but you're getting that aerobic, exercise that you wouldn't be doing if you're just walking in a normal pace. So we don't have to say, out of your, 8-hour, working day or even longer, that now you have to go to the gym. It's, no, it's about doing what you're doing and improving what you're already doing. Mm-hmm. And it's getting that empowerment and education to connect that as well, that you don't have to change your practice, you just need to do slight improvements to it.
Yeah, that's really important, isn't it?
No, could I tie that into the whole agricultural scene? Farmers don't have to work 18 hours a day. That's a myth. There's lots of farmers that are working 6 or 8 or 10 hours a day, and that. And Teagasc has done many studies, particularly in dairying, but in beef and sheep, and that. And our stand here at the Ploughing match, we're showing farmers how to cut workload so that they have more family time and more farm for exercise and for management also. Now, I'd like to tie in with a DCU, Dublin City University study, Farm Mental Health, which has published about 8 papers. Regrettably, they're showing that farmers need to get more messaging in this area. The latest data would show that 50% of farmers, don't get enough sleep. 25% are suffering from burnout, and that. So we're working on that. If farmers are working too hard, putting in too much physical hours, then they'll neglect their health. So agriculture development work and health promotion work are interrelated.
Yeah.
And maybe to just add on that, on what he's saying in terms of kind of increasing more messaging to farmers based on the data that we are collecting from research, is that's where now the program on Feirm Ground 2 is trying to fill into that gap, to ensure that, as many people that are interacting with farmers, so it could be vets, it could be advisors, so anyone who is coming into contact, then is trained to be able to hold those conversations or had those conversations in an informal way, so that you plant that seed of a farmer, so that when you leave the yard, then the farmer is left thinking about a comment or a message that you left that might make them, take that first step towards improving their own health.
Yeah. And I think that's really and I know we're coming up kind of to the end here now, and something that's really important is at that individual level, it's very hard for someone to go, and I was listening to George Graham there talking there, I was just kind of preparing, it's very hard for someone to go, if I tell everyone what's going on in my head, are they going to cart me? It's frightening. It's, it's hard to take that step into kind of taking care of yourself. It's hard to take that step. And I just finished there a few months ago an intervention with 6 farmers over 8 weeks, and every single one of them, these were farmers who were kind of, who were struggling with stress and anxiety. And we just did a quick 6 weeks intervention with them. And at the end, every single one said, I thought this was going to be awful. I thought this was going to be terrible. I thought when I told you what the kind of stress I'm under, like you'd be giving out to me. And they just said, it was such a supportive and such a good thing to do. And they were thinking, I don't have the time, but like 1 hour in your room over online. And there's lots of support and there's lots of help out there. And take that one step. And if you do anything today, it's take one step towards a better health. Whatever that is if that's walk up the hill, if it's that kind of reaching out to family and getting support, if it's saying I'm going to kind of reach out to one online, there's lots of psychoeducation, there's lots of mental health supports available. Take one step, do not go beyond today, and I think that's a really important, but take one step towards being the better you and getting the support. We all do it in our life. Like as academics, we get support, we have help, and that as medical practitioners, as clinicians, I'm a clinician in mental health, and we get support, and we're saying, we get support, and you come and get your support and make that step, and it's not as scary. I think that's a really important message. It's not as scary as you think it is.
I concur with the message. I think the challenge for farmers traditionally is that they've had to be stoic, and the masculine approach is that you're a big strong fella that can look after yourself, and you shouldn't be looking for seeking help.
Yeah.
We want a crucial message with all the studies and all the research we've done is that farmers need to connect in with health professionals, and to use them productively, to better their health, whether it's physical health or mental health.
Yeah.
Maybe one thing I just mentioned, we have a great person, Dr. Aoife Osborne. She's now farming in County Carlow. She worked in SETU at one stage, but she's done marvellous work in musculoskeletal disorders, which is physical injuries, back injuries and ligaments and, hurting yourself. So there's that aspect of farming as well. If you burst your back and, you have to try and farm for 30 years after that with it, it can be very debilitating.
Yeah.
So we're into kind of that physical aspect of occupational health as well.
Mm-hmm.
Okay, as we wrap up the conversation, then I'm just going to give you maybe a final thoughts each. Tracey, for your programme, is it business as always now for the next few months and next couple of years? Are you trying to ramp it up? I suppose it's a bit of cooperation there between the various bodies as well to get your programme out there.
Yeah, the future for our program is we're looking at, empowering people to do self-checks. So particularly farmers who have a pre-hypertensive, so normal, normal blood pressure is 120/70 and say 130/80 would be considered as pre-hypertension and 140/90 is hypertension. And just to educate people to do self-blood pressure checks. And I think with our, from our understanding and as the years gone by, we feel that people are, farmers are ready to have that education to be able to do self-checks. So that's one of the things, and sort of more conversations nurses will have about compliance in taking medications, because we've noticed that as well, and about the physical exercise and the differences, and improving your aerobic exercise as well.
Absolutely excellent, and it comes down to, Stephen, maybe a final word for you. The level of detail that John highlighted about the cardiovascular, despite the fact that you're taking so many steps, and maybe the overweight issue, it's staggering. But to go back to what Barbara said then, just to take one step can alleviate that problem. One small step, like Tracey said, a self-check, measure your blood pressure. Yeah. It sounds simple, but it's powerful.
Yeah. Actually, I concur with the message given. Actually, the one step is probably one of the hardest steps to make. Yeah. But once you do that, then it becomes a bit easier. And maybe one of the things that farmers, or even most of us, need to understand is the fact that opening up actually is not a weakness, because we are meant to believe that when you open up, it's a show of weakness. Opening up is a strength, because there is help out there. Yeah, and one of the things for us, especially from the on-farm ground program, is that we also tell agricultural professional and service providers that don't underestimate that small statement that you make to a farmer. That small check-in, an act of care, that opens all the doors where the farmer is able now to feel, to trust you and open up. So that is important for us. Yes.
I agree with making a small step, but adoption is a challenging business. There's stages of change model, and we need to keep encouraging people the whole time to take one step and then take another step, and keep at it gradually over time, because people might relapse and forget about something and that. But if they get the message regularly over time, then the whole population will move forward. Yes. Just my final comment really would be that it's very important to do ongoing research. Yeah. But it's equally important to communicate that to the farming population.
And Barbara, in your own brilliant way then, I'll let you summarise the whole chat for the last half hour, because the level of cooperation among your community is really striking. Yeah. There's a lot of great work being done. You're understanding specifically the issues at hand. Yeah. So the future, Barbara, what does the future hold, and how important is the future for your work?
I'm going to take an old word from farming, the methyl, that idea of all helping each other and the community, and and the academic, we're calling it a community of intention that goes from the very top, as John said, from big agency like Teagasc, the Department of Health, the Department of Health, and the Department of Agriculture, Food and the Marine, right down to that kind of individual interactions and that community, and how we kind of have community with each other is really important, and it's changing and it's different, but it's still community, and it's everybody reaching out to support each other, and that's how we move forward, and we're working at our piece, and then come in and join that, and as you say, kind of getting that message out is really important, but also coming in and giving a chance for community to work, and don't stay isolated, and allow community, you know, that kind of drawing on metal, and that idea of it takes a village to help each other and raise and move farming forward.
So research, messaging, action plans, re-messaging, and continuing to work together. They're the main takeaways from today as well. Yeah. John, final word to you.
I'll just throw in another quick one, policy. The research is there to inform policy, and you know that gives a long-term perspective to the research. Yeah. Thanks.
John, Tracey, Stephen, Barbara, can I thank you so much? And can we give them a round of applause, ladies and gentlemen, for their thoughts for the last half an hour or so. Thank you so much for your time. I hope you enjoyed the chat, and thank you to SETU for hosting us as well. It's a nice day out there. It's not too mucky, so enjoy the rest of your Ploughing Championship experience. Thank you, folks.